At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend breast thermography and early detection on Wednesday, September 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live. And I've got a very continuation of an interesting process that we need to go through so you really get the understanding of breast cancer. And we're going to get into that a little bit more, but we're going to talk about thermography. Remember, coming up September the 11th at the Roselle Center for Healing in Fairfax, we're going to be doing an evening on thermographic imaging and why it's better than every other type of diagnostic mode to determine the presence, particularly the initial presence of cancer. So, you've heard us say a little bit that with thermography, you can detect cells that begin to have a vascular supply, a vascular bed, anywhere between 3 and 8 years prior to the actual tumor showing up on other types of diagnostics. And remember what I said, that the tumor itself is the end stage. And that's when mammography, if you will, the process of using X-rays to determine and examine the presence of pathology in the human breast. The goal of mammography, if you remember, is to try to detect breast cancer. But how good would it be? How good would it be if you could pick it up well before its presence showed up as a tumor? Do you think at that point, a suggestive finger pointing might say, hey, we might be able to do something about it before we have to do chemotherapeutics and drugs and things of that nature and save your body, and ladies, protect your breast? And by the way, guys, we've mentioned it a little bit. I want to get into that a little bit more. Depending on the articles that you read today, anywhere from about 2.5% to 5% of all breast cancers are male, not just women. And, we've said that the reason for that is that the prostate gland and the breast tissue are the same, meaning that they attract estrogenic tags, and we're seeing far more prostate cancers and breast cancers. And by the way, as you've heard me talk about before, that we're seeing much more post-COVID than we've ever seen before, and some cancers that just don't make any sense. So we want to kind of explore that process. And just let me remind you, as we've talked over the last couple of weeks, that thermography, and breast cancer, right? So we're going to get into that. But thermography is not shown to be a standalone test. And Dareth Painter, who is going to be my co-presenter on the 11th of September, will tell you this continually. Once we see something that says, oh my gosh, there's a problem here, we need to take the next step and we need to do other testing to confirm what it is that we're doing. And that night she's going to get into very specifics about what it looks like, what it's about. So really be there with us. You're going to see pictures of the progression of breast thermographic imaging when it comes to, oh, there's something here, what does it look like? And mammography shows nothing, but all of a sudden it's there. And by that time, when it's there, we don't want it to be metastatic. We don't want it to be so invasive that now we're scrambling to do things. There are things that you can do at any stage, even from the natural world. And we may talk a little bit about that and tell you what we know that's out there, and at least give you information that you can make decisions on in any type of situation like that. But remember that thermography uses infrared, and I'm going to keep harping on that every time we talk about this, infrared technology to detect and record temperature changes on the skin surface. Now, why is that important? Again, we're going to repeat ourselves, and we're going to talk about the reason that it's important is simply because of the fact that it has, for breast cancer to show up, it has to have a blood supply. And that blood supply, again, 3 to 8 years will develop before the tumor actually shows on any other type of diagnostic. So if we can detect the blood supply first by showing the differentials in temperature from one part of the breast or both the one breast compared to the other, now we can say, hey, we've got to do something about this. And mammography remains, if you will, according to the medical community, the only proven imaging that will show a tumor formation. And that's not inaccurate. When the tumor mass is there, it'll show up. But thermographic imaging is something that will give you a heads up very early that something is not right. So, as when Dareth comes on and we're going to be talking about these things, and as she has said repetitively in the past, for those of you who have paid attention to the programs, it's important that we have early detection mechanisms that may save a life if we get curious. I would use the word curious, that there's something that is not right. And to be able to distinguish something that might be even an inflammatory, infectious problem, and then we get the opportunity to rule it out. Is it cancer or is it not cancer? So we need to put those things down. And I promise you, on the 11th of September, you're going to get a ton of data. And this is a person that you really can ask any question to when it comes to this type of diagnostics and what happens. There was a patient of ours that she came in and there was a something that was palpable. And her doctor had said, no, it's not a problem. It's just you have a cystic formation. And she had listened to one of the programs, and she decided to come in and get a thermogram done. And Dareth did the thermography, and she looked at the woman. She said, have you gone to your doctor? And she said, yes. And she said, what did they tell you? They said, there's not an issue. And unfortunately, she said, I think there might be an issue here that you really need to go have it take a look. So here's the unfortunate situation. After thermography, the order of diagnostics, if you will, should be first an ultrasound. The next one should be MRI. And then the last one could be mammography. Remember I said earlier, it is not a standalone. Thermographic imaging does not diagnose absolute, this is cancer, but gives a suspicion that we've got a cancer situation that's sitting there. So she said, go back again. And we sent her to a group of people that would do certain things. And they came back and said, I think we have something growing here. And so they did further diagnostics. And in fact, she had cancer. But often the look and see attitude, the wait and see attitude is not okay because it allows things to continue to move forward. And if they don't see it, they won't do the next steps. You don't, my opinion, this is Dr. Tom Roselle, and I'm going to give you a reason for it, that, they all want to do a biopsy of the tissue. Well, it's been proven in Europe and other places outside this country that when you do the traditional biopsies of breast tissues, if there is malignancy there, that you can inoculate the tissue around and surrounding the tumor. Do you hear what I said? It's possible to do that. There's ways of doing this thing safely. And in today's world, there's many different approaches that you can take from, if you find it without doing radical surgery, if it's an isolated ductal tumor, like what? Like cryotherapy, even heat patterns where they're going to inject in and they're going to destroy it that way without going through all the cut and stab and slice and things that they're doing. It's traditional patterns. You've heard us say, and you've been listening to the program, that, think about what mammography does. Mammography takes tender breast tissue and puts about a 45-pound weight on the breast tissue, right? And then it takes radiation. So we're squeezing very delicate tissue, very hard. We are perhaps metastasizing, my opinion, again, the tumor that's there, and my opinion is always based on literature that's out there. You go into the things that I encourage you to read over and over again, like PubMed and Frontier and the journals that really get it. And you have multiple doctors who have been in the field for a long time, and they start saying, yeah, maybe we ought to rethink this whole situation. It's like when a guy ends up with prostate cancer today, and this is for you guys, one of the first things they're going to do is they're going to inject you with Lupron. You say, okay, what does Lupron do? What am I talking about? Well, Lupron stops the production of testicular testosterone. And then the next stage is they take another drug and they stop the production of testosterone from the adrenal glands. Why do they do that? They do that simply because of the fact in their head, they think that the testosterone that is produced in the adrenal shell or in the testicles then at some point down expresses itself as estrogen. So they're trying to stop the estrogenic expression, which they feel will cause an increased exacerbation and metastasis in the cancer tissue of the breast and cause things to be worse, right? Well, here's the problem. Here's the catch-22. You need testosterone to heal with. So how do you stop it from converting into estrogens? Well, it's easy. Use what's called a estrogen suppressor, not eliminator, because you need a little for the tissue to heal as well. But it's called an aromatase inhibitor. Aromatase is an estrogen tag. And you suppress that expression, but you keep the testosterone, the good guys, at a level where your body can actually heal, right? So, by the way, when you come to the class on the 11th, and make sure you register, you can do it through drtomroselle.com or call the office directly at 703-698-7117. Register for class. If you scroll down the page, you're going to see a registration picture. You're going to see a picture of a thermographic image. Register. Ladies, I promise you're going to learn a lot. You can bring all your questions. Guys, generally we save this for women, but, because of the fact that you're susceptible to so many cancers today, and particularly breast cancers and prostate cancers, and there's a pattern that may show up that way. This is a good class for you as well. Grab your wife, and both of you come, and let's see what we can do to assist you and giving you more advocacy on your own part, things that you can do to make a difference. It's truly important. You really need to know. You really need to understand what your options are and how you can get it done. So when we're talking about this, if you will, at this point, cross-the-board problem, and it seems to be affecting more and more people, you need to know. You need to get it done. Even the National Institute of Health is talking about thermographic imaging or thermography as a breast cancer screening technique. And there's an interesting article. If you go into, it's called Cureus, C-U-R-E-U-S. It's a publishing, medical publishing group. And there's an article of 2022, November 14th. And it was published on the 8th of November. It says thermography as a breast cancer screening technique, and they reviewed the article. And if you go through it, and they're combining thermographic imaging now with, if you will, artificial intelligence to detect early stage breast cancer. And their conclusion was, and I'll read from the article, is that it can provide impressive results in early detection of breast cancer, and the technology is promising. So remember, you're hearing it from us. You're hearing it from the company that we have, Thermography Centers and Thermography Centers of Fairfax, by the way. And if you'd like to get that done even before, just give them a call and we'll get it done. Remember, Dareth Painter is the principal of the company. But here's what they said is really pretty interesting. 70% of breast cancer cases are detected, and as I said earlier, when the tumor size is over 30 millimeters. That's 70%. So they don't get around to it until then. They're not saying, really we don't have much to worry about. Let's wait and see. You know that wait and see crap? Let's watch and wait. I'm not sure what that's all about, but if there's a non-invasive way of finding things and you're trying to figure out ways to stop the mortality rise, and if there's an estrogenic tag, you can measure those too. There's very specific tests, and particularly when you're measuring hormone metabolites, if you will, that will show us the different types of estrogens that may be there. And, on the 11th, we'll also get into what's called, progesterone dominance and why these things come about. But just remember, we're talking about the early detection and prevention of cancer through a screening process that has been poo-pooed by many of the traditional medical establishments. Why would they do that? You should ask. Why would that be? Well, when they're paying millions of dollars in equipment, and the treatment of cancer, particularly breast cancer, is hundreds of millions of dollars annually in this country, if not billions of dollars. Do you think that they want to find it early? I don't know. That's just me running off the top of my head that maybe we ought to think about it a little differently. But when it's showing effectiveness, if you will, in breast cancer screening with very few limitations, but also with no side effects, none, zero, nada, you might want to take a look of doing something like that. And here's the other piece. If you're doing a thermographic imaging that has no side effects and you compare it to using a mammogram on a regular basis. So here's the deal. Ladies, if you've had more than 4 mammograms, you've increased your risk, and particularly back-to-back, annually, you increase your risk of developing a breast cancer by 60%. I don't know about you, but that sounds, pretty, got my attention. And because we see so much of this walking in with people who have shoulder pain or back pain, and it turns out not to be a structural deviation, but it turns out to be a problem that's arising from something that's growing inside of them and causing irritation, and God forbid it's metastatic, where it's gotten into the bone, it's gotten areas. So the next question you should have, would it show metastasis? The short, and again, as I will say repetitively, is it is not diagnosed what's causing it, but it finger points to something that is there. So if it's there, and we're saying, it's matching the symptoms, wouldn't it be necessary? Wouldn't it be important to take the next step and maybe doing something at that point more directed, more specific, more finger pointed? Early cancer screening for breast tissue has a significant impact on reducing mortality. Absolutely across the board, it drops the mortality rate. And in every country that has been using this, and by the way, they've been doing this stuff, as you've heard Dareth say, and you've heard me mention over time, for a long time. We're not talking a few months, we're talking about years. And so breast cancer occurs in women at any age after they've gone through puberty. But the rates dramatically increase as you get older. So doing a mammogram or, and you can do a thermography, but if you're doing a mammogram or things that are invasive in somebody who's under 50, unless you got a pretty damn good reason that you're doing it, I don't know about you, but not my family. I'm not going to have my daughter. And, my wife, the only thing she ever does is mammography. And, if we have to send out for ultrasound and so forth. But the survival rate. Here's an interesting statistic that I came about in prep for this program. The survival rate in countries outside the United States, they're called developing countries. What does that mean? Is around 50 to 60% when it comes to breast cancer, due to the fact that they can't detect it early on. So globally, breast cancer is the reason for, more disability when it comes to, looking at lifespan, and and it's lost to ladies, to you. And now, guys, you're stepping up to the platform. Years ago when we talked about heart disease and lung cancers and so forth, pretty much finger pointing towards guys. And now, ladies, you're catching up there too. So it's like it's flipping. Guys, it was unheard of that you would ever have breast cancer. But you know what? We're starting to see things. We're starting to see our environment change. And we really need to make sure those things happen. But also, prostate cancers metastasize with an estrogen tag. But they also have to have a blood supply. And if you can identify that blood supply through something that's non-invasive, like thermographic imaging, guess what? Now you can do something perhaps beforehand, before it gets to the place where they say there's nothing more that can be done. But, you know me, there's always ways of doing something. And, I'm the guy that's going to say, why don't you go check this out? I'm not telling you not to do something. I'm telling you to check it out. Sometimes, even if breast cancer is present, right, the mammogram looks normal. And we've seen that repetitive. You're going to hear Dareth talk about that, why that is. So you have these false negative results. How often, you might ask? Well, how about 1 in 8 breast cancers? That's a huge number. 1 in 8 false negatives when it could be sitting there. So women have a false sense of security sometimes when they go in and they get a mammogram and they say everything's okay. And they say, yeah, just make sure you get your annual or your biannual mammogram. But these rates are crazy. So the other thing you might ask is, how about false positives? Yep, there's false positives too. And the false positive, they're saying, you got cancer. Now they're going to go and do a biopsy. And, they say, well, why don't we just take as much tissue, as we can, right? Because we don't want to do the biopsy, and if we do the biopsy, we might spread the cancer. Well, the false positive results can be due to the presence of breast tissue that's dense tissue. There's a history of, breast biopsies, or, here's the other piece that they didn't think about. I was telling this to a patient the other day. She said she went to her doc and she had certain things that took place, and he was suspicious, and, they sent out for a mammogram. And I said, are you on estrogen? And she says, yeah, I've been on estrogen replacement for quite some time. Well, you know what? That's probably why you got an inflammatory reaction in the tissue. The cancer is not there, but the odds are highest of false positive findings for the first mammogram, the first time you do it. If there's any changes, the guys lose their mind and they say, hey, we got a problem. And so you got to really think that thing through. So be with us on the 11th of September, coming up pretty rapidly now. And register for the class. Go to rosellecare.com or go to drtomroselle.com. And I promise you're going to learn a lot about what this amazing diagnostic procedure is. And we're going to talk about, clinical breast examination. We're going to show you what it looks like. But this is, this is an important piece. You need to have enough understanding of it so you can do what? So you can ask the right questions. So when you're dealing with clinical and self-examination, to improve detection up to 87%, how cool is that? Just remember, the 11th, put it on your schedule. We're coming up to a break, but I want you to follow me immediately after into the live stream. So we can get into this a little deeper, and we're going to really unveil a few things for you. But remember, I'm here every Sunday doing this for you for one reason only. Very simply this. You deserve it, but more importantly, I love you all. Have a great Sunday. Talk to you soon.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.